Welcome to our Leaping into Health series where we are going to be deep diving into ear infections. I'm Dr. Callie Horseman. I'm a pediatric and animal certified chiropractor located at the Hive Chiropractic Center right here in Holman and Galesville, Wisconsin. So, one of the main reasons we chose to make this our first topic is that we just hear this so often. Parents come into our office and say, we have had 2, 3, 4, 5 ear infections before the age of 2. And we ask ourselves, how can we stop this from happening? Just because this is a common childhood ailment, or you might know a million people, a million other families who are dealing with ear infections as well, it does not mean that this is normal. Normal function is that the body has an innate ability to heal itself. So think about it like this. So you get a paper cut, the body heals itself. You break a bone, most times your body can mend that broken bone. So this is what we call being in that rest and digest side of our nervous system. Our body is healing itself. We have that innate ability to heal. But what happens when we are not in this innate ability to heal? What happens when our body is stressed or not in that rest and digest? We call this being stuck in a state of fight or flight. And that's when we can see a very different response to ear infections, is that we get chronic ear infections when we're stuck in a state of fight or flight. So that is what we are working with here at the Hive. How can we help to remove interference on your system so that your body can do what it was designed to do, which was heal and adapt? Our nervous system controls everything in our body, and my job as a chiropractor is to make sure that you can do that without stress on your system. So, what are we really looking at with ear infections? It really boils down to a poor plumbing problem. So, when we come in contact with a virus, our body might spike a fever, it creates more mucus just to slow the spread of that virus, and you maybe even develop a cough just to help push out that junk. So, this is a very normal situation. That is our body responding exactly how it should. It's trying to stop the invader from getting into our system. But however, what we commonly see is that the fluid actually just gets stuck in the sinuses and in the upper neck, and the body is unable to push that extra mucus down and out. So instead, it just kind of sits there and creates inflammation and pain, and then it gets labeled as an ear infection. So my job as a chiropractor is to see, why is that not draining? And honestly, the most common thing that I see is called a C1 subluxation. So C1 is just our body's first cervical vertebrae. It sits right behind our ears. And oftentimes when we have ear infections, this bone is out of alignment. So this is where we have that plumbing problem. So it's blocking the drainage from the fluid getting down from the ear canal, down through into the back of the throat, all the way down to the stomach, and then pushing it out through our digestive system. So C1, we call this bone the body's brake pedal. It helps put our system into that rest and digest. So when that bone is out of alignment, it puts stress on the nerves that innervate the face, the upper neck, the ears, the nose, the throat. It also stresses the muscles that connect to the upper neck and to the ear canal. It causes the lymph to stay stagnant and not drain. And it also causes a decrease in our immune response, making it more likely that this is going to occur again. So you might be wondering, how does C1 become misaligned? Like, what happened? Why is this like this? And the biggest reason that we see this is due to birth interventions and trauma. So you might have had what you thought was a typical birth, again, a common birth, but maybe not a normal birth. So this could be due to things like excessive pulling, a C-section, induction, the use of forceps or vacuums, even just a long or stalled labor, all can cause C1 misalignment. So we also see this if the infant has early health challenges like colic, reflux, torticollis, where they're not able to move to their head both sides. And it could also be due to an exposure like an antibiotic early in life or steroid-based drugs. So knowing all of these things, what is the solution? The first thing that we're going to do is just dive into your child's health history. Were there any signs of birth trauma or interventions? Each of these stressors causes our system to be stuck in that state of fight or flight. When we're stuck in this pattern of that chronic fight or flight, our muscles tense, our lymph doesn't drain, our nerves receive poor feedback and communication, and the muscle that helps drain the ear, it's called the tensor veli palatini, it becomes tight and stressed, which limits the drainage of the eustachian tube. This cascade of events causes the ears not to drain fully. The immune system becomes stressed, and then our nervous system can't do what it was designed to do. It can't heal, grow, and develop. So, to break this cycle, we choose to start with chiropractic care. After gathering your child's health history, we perform a series of nervous system scans. And through these scans, we can see muscle activity. So, again, do you have extra stress at those muscles in the upper neck or at C1? Then we're going to see nerve inflammation. Is there chronic stress at that C1, C2, C3, any of the nerves that go to our ear, nose, and throat? And it's also going to tell us if your child is stuck in a state of fight or flight or rest and digest. So yes, we can measure that with something called an HRV. It's a very cool piece of technology that just shows us, is our system in a state of healing and growth, or is it under stress? And are we fighting or flight? So from there, we get to perform specific chiropractic care to remove stress on the nervous system so that your child can do what they do best, which is heal, grow, and develop. What we end up seeing by practicing this way is kids not needing to get tubes that were previously scheduled to get tubes. We have kids who have had repeat tubes not need them put back in. We've had no longer the need for tubes. Parents are not losing sleep or missing work due to their kids being sick. We've noticed kids being healthier and happier, less congestion and kicking colds faster, better movement in the upper neck, and of course, sleeping better. So, if after hearing about our approach to ear infections and you think that your child might have a misalignment or maybe stuck in fight or flight, please reach out to our office and we'd be happy to deep dive into your child's health and just see what's going on. See if we can get to the root cause of what's actually happening with why your child is getting ear infections, and especially if they're getting repeat ear infections. We are here to help. I hope this information has been helpful. Again, reach out to us. Our office is always a resource for you.